Hi, I'm Dr. Brian Thornburg. Should you delay cord clamp at the time of delivery? We had our first baby in 2002. I was in pediatric training at the time. A lot of my friends were OBs because we had to attend the deliveries. Plus, I lived in the hospital about 120 hours a week. My best friend was an OB and he was in his residency. Once he heard about delayed cord clamping, again, this is in 2002, it's like, no way, don't do that. That's a danger to the baby. You don't want the extra blood to go into the baby. Bad news, don't do it. Let's fast forward to today. Now the recommendations from the American Academy of Obstetrics and Gynecology states that you should allow the cord to pulse a little bit to allow some increased transfer of blood from the placenta into the baby. Their recommendation is 30 to 60 seconds. We move more blood into the baby out of the placenta, and we're going to increase iron stores. All babies start to decrease their iron stores after delivery because they change their hemoglobin from fetal hemoglobin into adult hemoglobin, and in the process their hemoglobin drops. And so by transferring more blood, more iron from the placenta into the baby, then you're going to have higher iron stores, and then there's going to be a less of a trough or a low point of the hemoglobin as the baby transitions. This is important for development. If you want to improve growth, you want to focus on the energy possibilities. Iron, hemoglobin carry oxygen. Oxygen allows mitochondria to produce energy. If we have an improved source of energy because we have more iron, then the baby's going to grow better. And we know this not just from a physiological standpoint, but also their brain is going to be better. We know that at a year old, when we check baby's iron for the first time through a hemoglobin check, if the baby has low hemoglobin, then that baby will have few points lower on their IQ test compared to if they didn't have a lower hemoglobin at this point. So that's one of the reasons why we want to allow the cord to pulse out for 30 to 60 seconds after the baby is delivered. Any further negative effects have really been shown not to happen. The scientific literature is not supporting increased blood transfer from placenta into the baby, and then you have more negative outcomes. That has not been proven to be true. Why stop at 30 to 60 seconds? That's more of a practical issue because you can imagine in a hospital, at least in my hospital, they're delivering about 400 babies a month. That's about 12 deliveries a day. And when you're moving from delivery to delivery to delivery, if we have to pause and wait an extra 2.5 minutes for the cord to pulse out instead of just cutting at 30 seconds or at 60 seconds, that's going to delay any kind of moving on to the next room. I've delivered cows in my backyard. Mammals, they allowed the cord to pulse. Cats do that. Dogs do that. So it is a natural mammalian experience to have a cord pulse out before you stop the blood flow. I think it is a very beneficial approach, but of course, I'm receiving the baby after the baby comes out, so this is a discussion for your OB. I just have a lot of experience with 8 kids. Thanks.